Okay. Welcome, everyone. We're going to go ahead and get started. Thank you for joining us for the BeWell information session for the 22-23 program year. So if you are watching this live or recorded, just know that this applies to participation between November 1st of 2022 and October 31st of 2023. So hopefully that helps you keep track a little bit. The game plan is I'm going to run through some slides, give you an overview of UCA BeWell, and then I'm going to open it up for live questions and answers. So hopefully you've got questions and hopefully I've got answers. Hopefully that goes like that. And then at the end, I will share the process for claiming your 5 points for attending today. So we're going to go ahead and get started. So a little bit about BeWell. BeWell is the Employee Wellbeing and Health Promotion Program for UCA faculty and staff. We offer a comprehensive suite of free programming and resources to support all dimensions of well-being. So this is much more than just exercise and eating right. This is all dimensions, including mental and emotional well-being. And for UCA health plan members, you can complete activities to qualify for a discount on your health insurance premium for 2024, and also have the opportunity to earn up to $100 in Bear Bucks. And we'll talk more about that in just a minute. I always like to say we really hope that you'll participate. We encourage participation, but participation in employee wellness program is completely voluntary. And why do we do this? It all comes back to our mission of supporting student learning and success, facilitating that student learning success. And we know that healthy and happy employees are more equipped to do that, or better equipped to do that. And this is a win-win for employees, for students, and also the university, because we know investing in our employees will reduce health risk factors and absenteeism. It will increase those healthy behaviors and, of course, productivity while we're on campus. And then we're also working to minimize healthcare costs for the university's self-funded health plan. When we invest in our employees, when we help our employees take care of themselves, to prioritize getting to the doctor, getting that annual screening, taking care of those age-appropriate cancer screenings, our healthcare costs are lower. And that in turn helps us keep our health insurance benefits package as competitive as possible. Okay, so I mentioned we offer a comprehensive suite of resources and programming. These are, this is kind of like our highlight reel. So we offer wellness webinars, virtual, as well as in-person workshops. We have what has really become our flagship programs, our weight management and diabetes education. We offer health coaching through Health Check 360. We offer nutrition counseling on site, which is also free. All of these are free. We offer mental health counseling and support for employees and their families. Free access to the Hyper Fitness Center, pool, group X classes, you name it, the Hyper's got it. It's amazing. Go check it out. And then on-site vaccines and annual health screenings. So lots to choose from, again, hitting on all those dimensions of well-being. A little bit more about mental health support. We offer our Employee Assistance Program, also known as our EAP. This is confidential short-term counseling and mental health support for all benefits eligible employees, as well as their spouses and dependents. So there's no cost to you or your family members for using EAP. And they're happy to meet with you here in Conway or in Little Rock, or they'll even do a phone or telehealth appointment with you. And just so everybody knows, we do contract with licensed mental and behavioral health specialists through UAMS, so the University of Arkansas for Medical Sciences. It is completely confidential. I do not know who utilizes the service. I just receive an aggregate report with some number data, but nothing includes anybody's name or any identifiers. Okay, so let's switch gears and talk about incentives. So this is sort of a broad overview. So we have two incentive programs. We have our opportunity to earn a health insurance premium discount. And again, the timing gets a little confusing. Right now, we are working towards our discount for 2024. So $20 or $40 off per month. We also offer the opportunity to earn up to $100 loaded to your Bear card. And I also want to point out that we also have a reasonable alternative standard program. And you can work with Health Check 360 or your physician to utilize an alternative process to meet the component requirements. So you can contact Health Check, and I list that here on the screen. So a little bit more about the health insurance premium discount. It's important to note that this is participation based. So anybody that participates in the biometric health screening and the health risk assessment survey automatically qualifies for that $20 per month discount, regardless of the health score. That's for the standard. If you score 75 or higher, or improve by 5 or more points from last year's screening, that's when you bump up to that $40 per month discount level. So that's our gold tier. So just a reminder, Halloween, October 31st, every year is our BeWell deadline. I encourage you to grab a Post-it note or put it on your Google Calendar now. It's great to get it on the calendar now, maybe even set a reminder for 60 or 90 days out so that you have an opportunity to get all of your, get your screening done and get your survey done before that deadline. We make it easy as possible. We make it as easy as possible to participate. We don't make it complicated. We offer on-site screenings conveniently located at the UCA Student Health Clinic. Typically, we announce the dates in March and they start in May after graduation. There'll be more information announced in the spring, but typically we offer a few weeks in May. We try to give the health clinic a little bit of a break over the summer, and then we pick back up in July, August, and then into the fall. There is no cost for eligible employees. So these are benefits eligible employees enrolled in UCA health insurance. Our colleagues at the clinic are wonderfully efficient. They will get you in and out in under 15 minutes. The appointments, of course, are confidential. They are compliant with HIPAA, as any other medical practice would be, and you don't need to take any sort of physician form with you to do that on-site screening. However, we also offer options. We know that some people would rather complete their biometric screening with their own physician, and that is totally fine. So you can screen with your own PCP using our physician wellness screening form, which I've showed an example of here on the screen. You can download that form from your account on My Health Check 360, or it's also always available on the BeWell website, which is uca.edu/BeWell/forms, listed here on the slide if you're watching this recorded. And okay, now we're going to switch gears to our BearBucks incentive. So this is a separate program. You have the opportunity to log healthy habits and activities. This includes things like cancer screening, so mammograms, skin checks, colonoscopies, pap smears, things like that. You can log your dental visits, your vision appointments, diabetes consultations, your mental health care visits, and then also things like volunteering or DBIE activities. All of those things can earn you points, and those points correlate to BearBucks. So either $50, $75, or $100 will be loaded to your Bear card. BearBucks are loaded in early December each year, and there's the same deadline for this incentive program. So get everything completed and logged by October 31st of 23. So you can add that to your to-do list as well. And to make it easy to participate, we partner with Health Check 360. They offer a lifestyle management tool called My Health Check 360, which is available through like a desktop or laptop portal or the smartphone app. And they're also refreshing this. And so early in 23, we'll actually see a new version of the platform rolled out, which I'm really excited about. But this is kind of what it looks like. Gives you a little teaser of what you expect when you log in. And just a heads up about how to stay informed of what's going on with BeWell. Again, we offer a very robust schedule of activities and programs throughout the year. You can find us on the calendar tab on the BeWell website, so uca.edu/BeWell/calendar, or from your Google Calendar, you can just search UCA BeWell, that's 2 words, and that should pop up, and you can turn our calendar on or off as you desire. Easy way to stay informed about what's going on. And so I always say, if you are ready to be well, if you are not currently enrolled, you'll want to go ahead and elect your benefits. And once that happens, once HR completes their onboarding process, then you will get an email from me welcoming you to the program. So you can follow those instructions to get started. If you are an existing employee and you need help getting started, you can contact me, UCA BeWell at uca.edu. I'm going to show a slide at the end with my contact information. Please reach out with any questions. Of course, you also have the BeWell website, uca.edu/BeWell. We'll walk you through the process as well. So this is my contact information here. I just mentioned it. I'm flashing it on the screen, particularly for those that are watching this recorded. Please reach out with any questions. I am going to open it up for live Q&A here in just a moment. I just want to run through these slides real quick before I stop share. And then if you're not staying for the Q&A, I'm going to go ahead and include this now. So if you would like 5 points for attending today's session, you can take a screen grab or a photo on your cell phone, whatever works for you. You can load that up to your account on My Health Check 360 to earn 5 points. Please use the BeWell Education Sessions category. Do not email it to me. Please load it directly to your account. I'm going to leave this up here for just a few more moments, and then I will flash it again at the end. But then I'm going to stop share so we can open up the floor for some questions. All right. All right, so what questions do you all have? I'm happy to help. Anything?
Mariah, can you go over again how to find the BeWell calendar?
Yes. So either on our website or using your Google Calendar option. So let me walk through the Google Calendar one, and then I'll share a link to our calendar from the website too. So if you're on your Google Calendar, and I'm looking off to the side right here, it is on the left-hand side. It says under the little like miniature calendar, it says meet with. And if you type in UCA BeWell right there, 2 words, I should pop up. And that should get you there. And I'll also put a link to the BeWell website in the chat real quick. Just give me a second. Should have had that ready to go. Here we are. I saw another question in the chat. I will get to that. And there's the direct link to our calendar on the BeWell website. Question in the chat. Sorry, Susan, does that answer your question? Did that get you there? Okay, great. Good. Do bear bucks expire? Great question. I do get that a few times a year. No, they don't expire. It really just, you have to have an active Bear Card account. So as long as you remain affiliated with UCA and have that account active, you'll be good to go. They don't expire. They roll over, you know, it just stays. There's no difference year to year. That's a good question. Anybody else? Does anybody want me to log into My Health Check 360 and show them around the website portal? Yes, I'm seeing yes. Okay, I can do that. You got it. All right. Let's see. I'm going to log us in here. Please, somebody let me know if you cannot see this. I don't want to get through my whole thing and have someone at the end say, I didn't see what you were showing. All right. So as long as you can see that, I'm not seeing anybody telling me no, we're good. Okay. So this is what it looks like when you log in on a desktop. Kind of has your main dashboard here, and I'll show different things. So I'm going to first go on this left-hand side. We've got track health, and this is where you can use the features to track your eating habits, your hydration, your physical activity, and then things like weight, your hours of sleep. There's even a journal feature. Helps you build work on your resilience. So kind of marking your attitude, journaling, do a little bullet journal there. You can also keep track of your blood pressure and your glucose levels if you're diabetic or pre-diabetic, and working with your physician on that. And then also there's even a tool for nicotine cessation as well. So we do a lot of challenges. We run about 4 a year, and typically it includes tracking. So this is where you'll track. And a tip for those of you that may be new, you can sync your favorite compatible wearable. So like a Fitbit, Garmin, Apple Watch, things like that, or your favorite fitness and wellness apps like MyFitnessPal. You can actually link those to Health Check 360. And so it'll automatically pull that data into the system and help makes tracking just a little bit easier. I mentioned challenges, this challenge tab on the left-hand side. You'll see your options there. I do not have any challenges loaded yet. You'll see the first challenge in the new year, so stay tuned for that in January. My program is going to have a little bit of an overview about our program here. So I'm just going to click on my company and show you all that there's pretty much everything that you need to know about the program here. It mimics what we have on the BeWell website. This also includes your forms. So your physician wellness screening form, if you'd like to screen at your own physician's office, is available here. And then also what we call our preventative care visit form, which is kind of confusing because biometric screening is also considered preventative care. But this preventative care form is really for things like your cancer screenings, your flu shot, your eye doctor, your dental, etc. You can also just use like an explanation of benefits or a receipt or some sort of printout from your visit. Anything that proves participation is fine. We are not picky. Let's go back up to survey and results. So my program and then survey and results here. So I've screened for 5 years at UCA. All of my reports are included here. This is an awesome feature, y'all. I really hope you'll go back and check this out. These reports are very valuable. I'm not going to click on it because it'll come up as a PDF and Zoom will probably freak out, but it is a kind of stoplight system report on your biometric data. It helps walk you through what your score means in each of the categories that we score on. Very, very helpful. It talks about your risk factors, gives you excellent advice about how to improve your risk factors. Really valuable. So if you ever want to look at your report, check this out. This is also where you're going to find your score every year. So remember we talked about those tiers, that $20 or $40 and having to get that 75 or higher to get that higher tier discount, or improvement factor, that improvement by 5 or more points from the previous screening. You can check that out here. Again, in early 23, Health Check 360 is going to get a little freshening up. So things might look a little different, but for now, this is what it looks like. Very handy. You can also click this button and fax your results directly to your physician's office. Also a great tool. Let's see, if you want to schedule health coaching with Health Check 360, you have unlimited access and it is totally free. So you can navigate over here and get scheduled with them. More information about our reasonable alternative standard that I mentioned. If you need an alternative way to reach a benchmark, you can utilize this program. It is available to you. Let's skip down to lifestyle rewards. So we are, again, we're in the 22-23 program year here. Sad, I have 0 points so far. I've got to load my stuff up. So let's just go through this. I like this because it's very visual, a little bit more visual than the app, just because we got a little more screen space to work with. So this will walk you through. You can get points, your lifestyle reward points, for completing your screening and your survey. They are 2 separate incentive programs, but we do try to incentivize getting that biometric screening and survey done, just giving it a little bit of a boost by also giving you points for that. So points for those, completing a challenge like I talked about, completing health coaching calls. You can attend webinars like this one, which we're doing right now to get some points. You can load that up here. That's where you'll load your points for today. Using the Hyper Center, submitting a healthy selfie, DBIE. I'm not going to go through each of these, but you'll see there are just a number of different options. Again, touching on all dimensions of wellness. I love this one: arts, cultural event, sporting event, or visit a museum. You get points for that. Donating blood, volunteerism, community service, taking a hike, enjoying all of our wonderful 52 state parks in Arkansas and 8 national parks. We've got a lot going on with just the awesome natural resources in our state. So you can take advantage and get points for that. And then it moves into more of our healthcare. So dental, eye, cancer screenings, nutrition counseling, diabetes support, mental and behavioral health, nicotine cessation, vaccinations, heart screenings, and our prenatal and postpartum care. So lots to choose from. Again, we don't make it hard to participate. We try to give something for everybody. So that's all there. And then one more thing I wanted to show you all is the coaching pathways. This link on the left. This is where you're going to find all of Health Check's articles and recorded webinars. They're very good content, evidence-based. So check that out. You can get points for viewing their webinars as well. We have that option on hiatus, but be looking for that option to earn points in the new year. It's just going to look a little bit different. So we're going to wait on that category, but you can go ahead and watch those webinars. They are awesome. Let me check the chat. So Bridget says, if the screening is confidential, how is the 75 points calculated? That's a great question. So first of all, I want to touch on the confidentiality. So I don't see scores. I just see whether or not you completed the screening or not. So just so you know that it's kept behind a privacy wall. So the scoring is standardized. So let me give me a thumbs up, somebody, if y'all can see my tab now that I've gone to the BeWell website. Can I get a thumbs up on that? Yeah, okay, good, thanks. So the BeWell website, if you go to biometric screenings, I've got some good information here. So under scoring, it says scores are based on 7 risk factors. You can click on that. And we score on 7 risk factors. So blood pressure, your total cholesterol ratio, HDL, which is also known as the good cholesterol, LDL, which is the bad cholesterol, your triglycerides, your glucose, and then your nicotine status. Those are the 7. So hopefully I've answered your question about how we score and about confidentiality. If I haven't, please pop any clarifying questions in the chat. I'm happy to answer those, but this is always available on the website. This will kind of help you plan ahead. And if you have scored in the past, again, I'd recommend you check out your score report from last time. You can kind of see where you are and then make a plan for where you want to be the next time you screen. That was a good question. Anybody else? It's really good. I'm going to stop share because I'm on a laptop. That way I can see everybody. Any other questions? Okay. All right. Does anybody need me to flash the certificate on the screen again? If you do, kind of wave your hand or put something in the chat. Yes. Okay. Not a problem. Let me get back to that. All right. Here, let me go to slideshow again. There, so it's big. All right. If anybody needs to grab that, again, claim your 5 points for today. Thank you all for attending. You can grab a screenshot of this or a snip or a photo on your cell phone, load that up and get your 5 points. Use the BeWell Education Sessions category. Thank you all for attending. I am going to stop the recording. If anybody wants to ask a question without the recording turned on, I'm happy to do that. But thank you all. Have a wonderful afternoon.